very exciting. 3 abstracts were in the oral session in kidney cancer that I had the pleasure to discuss and add a lot of knowledge actually to a new knowledge to the field of advanced RCC, advanced untreated clear cell RCC. First, KEYNOTE-427, presented by Dr. McDermott, explored actually the role of single agent Pembrolizumab in clear cell metastatic untreated renal cell carcinoma. Response rate were around 38% and in PD-L1 positive 50%. And there was no safety signals that we didn't know about this drug, Pembrolizumab. Really, this bodes favorably compared to other agents or combination in this setting, and it's quite safe. There's another cohort in non-clear cell RCC that hopefully will be reported soon. But that's quite, interesting, and the main question, to ask, should we start looking at single agents rather than combination? Most of the phase 3 trial, including, for example, Checkmate 9ER, Cabozantinib, Nivolumab versus Sunitinib, are combination, and there are other combination. There are not really, to my knowledge, phase 3 trial in the metastatic setting with a single agent checkpoint blocker. Second important study that came probably at no surprise is a small study from Italy, a randomized trial of Sorafenib versus no Sorafenib observation in patients with M1 and ED. So high-risk RCC with metastases that were resected, and the imaging show no cancer. What do we do here? Historically, we extrapolated actually from the high-risk adjuvant setting. And in that space, we have 3 negative trial, 1 positive trial. But then the study presented by Dr. Procopio, called the RESORT study, showed absolutely no benefit in recurrence-free survival. It's a small study, the follow-up is short, the event were less than 50%, but it solidified the fact that in M1 and ED, the best option would be observation or actually clinical trial. And there are 2 ongoing adjuvant clinical trial with checkpoint blockers, Atezolizumab and Pembrolizumab, that allow patients with M1 and ED. There is also trial from ECOG with Dr. Appelman, E2810, that is still small, around 128 patients with Pazopanib, same as Dr. Procopio's study. And the third abstract that was presented in the oral session was a study called IMmotion151, but the quality of life, presented by Dr. Escudier. This study has been presented in terms of efficacy by Dr. Moser at the last ASCO GU meeting. It's a combination of frontline untreated metastatic clear cell RCC combining Atezolizumab, the PD-L1 inhibitor, with Bevacizumab versus Sunitinib. So the study primary endpoint had 2 co-primary endpoints: progression-free survival by investigator assessment in PD-L1 positive patient and overall survival. The first one was met. Now Dr. Escudier presents quality of life data, and really it's impressive that overall 12 out of 17 treatment and disease-related symptoms, were much better to a degree, made it to clinical relevance in the combination. Sunitinib is the control arm given at a schedule 50 milligram, 4 weeks on, 2 weeks off schedule that many experts and many folks in the community do not use. They use the 2-1 schedule, but nevertheless, this is the FDA approved schedule. So very dynamic, very interesting session, contributes again to our knowledge of advanced RCC.